right, SuperStat fam. Today we are doing something a little different. We're putting a circulating idea on the table and letting it breathe. So, high COVID IgG titers might actually be harmful, and vaccines may be driving that risk.
Oh,
Just gonna
Mm.
put that out there. Not saying it's true. Allegedly. Put on my Wendy Williams voice. Allegedly. Not dismissing the pub
allegedly.
allegedly. Not dismissing the public online chatter
Mm.
either. But we want to get into it and we don't want to miss this opportunity to talk about it.
Okay, people. I'll say what I think people are thinking. You get vaccinated multiple times, your IgG titer goes up. Huzzah. Some studies hint at immune shifts, so like IgG4. People still get infected. Others say a high titer means you're going to have worse symptoms, like moms across America posted. Everyone can have an opinion. Something related to correlating the quantitative results to the higher risk cardiac damage, blood clots, neurological complications, and cancer. So, question kind of becomes: are we overstimulating our immune system? Okay, and could high IgG actually signal something that's kind of off? Okay, more isn't always better, right?
I mean, that's well summarized. There's a lot of traction around this, and it's so funny that we're, like, 5 years now, like, past COVID, and we're still
That's
having
crazy.
this kind of conversation. But they're totally fair questions, and we have to really lean on the scientific literature as, like, laboratory professionals. There's been a multi-center cohort study with over 1,000 hospital COVID-19 patients from 5 different hospitals, which identified, that hospital patients with, like, a low antibody level combined with high inflammation markers had the highest mortality. Whereas, like, in comparison, the higher antibody levels were actually associated with lower risk and less severe outcomes. And, there was another study, like, in severe COVID-19 patients measured at, like, 7, 10, 12, like, 14 days after onset, and these patients were divided into survivors and non-survivors, and that showed, like, higher IgG, IgM titers in survivors versus non-survivors, suggesting a protective association with IgG. And then on your last, like, point there, related to, like, worse outcomes, there is a study that talks about 30-day mortality. It's an observational study, but it looked at the effect of IgG spike antibody responses in hospitalized patients, and they found that the low anti-spike antibody levels correlated with poor outcomes and hospitalized breakthrough cases. And then there's also multiple studies that are showing similar information that low titers early in disease are linked to poor prognosis and like long-term mortality. So I think the question being asked though is like when people are bringing this up is does high IgG predict worse outcomes? Like, can you use the number to say like I'm going to be on the bad end of the scale? And I don't think clinically the answer the clinical answer is no, right? Because the validated data cohorts tell us that.
But the interesting part is the idea keeps coming back up. So, why do you think that is?
So I think it's because it feels right. So high lab value equals bad,
Mhm.
immune activation equals inflammation, and then repeat exposure could potentially just increase that possible dysfunction. So one could argue that it's not a conspiracy, that it's pattern recognition.
Yeah, I think that's where the nuance gets lost too for the public at large. I think, to your point, there are other situations where high lab value equals bad, right? And so if you're trying to, what is it? Correlation does not equal causation, or
Mhm.
something. Yeah, like right. And so I think there's a lot of that though in society, because like we know scientifically, IgG is a marker of exposure and immune memory. It's not a direct measure of immune quality, right? Like, and
Exactly.
definitely not a standalone predictor of any outcome. So
Okay. Well, Dr. Nelson, let's sit in the uncomfortable middle for a second. Like many of our listeners may be, some of them who may not be as well trained as our clinical chemist on the call. Is
Agreed.
there anything in this that is worth exploring from a layman's point of view?
Yes. We just have to do it carefully, and in good company. I mean, we do know immune responses are complex. We still have subclasses like Aaron mentioned IgG4, those are still being studied. Not all antibodies are neutralizing. Like there's some things there that definitely need to be studied. We don't understand the complete immune system. We're still learning things about it every day. But I think getting at the recent, like, posts and things on social media, Facebook or Instagram or wherever, is that none of that translates, though, to the idea that an independently high IgG is harmful, right? Or that vaccines create dangerous levels of antibodies. Like, we can't lose the forest for the trees, if that makes sense.
Okay,
Mm.
so what you're saying is that there's science happening, but it's being overinterpreted in public spaces. Is that what you're getting at?
That yeah. Mhm.
But do we think this is a continual shift in our culture because we're moving to a world where people can have direct access to lab and order them through accessible platforms like Function Health or what's the other one that's it's like WAP or WOMP,
Or yeah, like
Whoop,
Whoop and Aura. Like Aura's the one,
Whoop and
The
Aura.
Ring brand
Yeah.
is doing it
Yeah.
now, right?
Mhm.
Mhm.
So a couple of days ago, even on mainstream coverage from NPR, they were highlighting this shift.
So it's definitely it changes how the public relates to scientific literature. Instead of debating this in a journal, people are seeing this on their own in real time on social media and just the mainstream media and hearing COVID IgG high and then kind of what?
Yeah, you're hitting at the post-analytical issues, like interpretation becomes the problem.
Right. So there's no clinical context.
Yeah.
There's no timing consideration, no understanding of the assay variability. The risk isn't the result, it's the meaning assigned to it, I guess is what we're saying.
Yeah, there's no laboratory professional, there's no clinician, someone to kind of help you interpret these things. So it's kind of an on-demand testing plus some partial science equals amplification of potentially harmful ideas. And even what we're seeing a lot of now is medical mistrust.
Yeah, I like the way y'all framed that. Because there are definitely benefits to taking ownership of your care and personal health data. Like, that's a real thing, and we should be engaged in that process. I firmly believe that. And I shouldn't say but, because that negates my former statement. What I will say is access by itself doesn't create misinformation, right? It simply possesses the ability to accelerate someone's misunderstanding of the medical context because you're not trained to look at it in context. You're just looking at the number and the flag associated to that number in your portal, perhaps.
Okay. So here's the closing question as we wrap this up. If patients can access their labs anytime, who owns the interpretation? So NPR called out most of these contracted physicians by those on-demand services aren't truly accessible.
Yeah, so it has to be laboratory medicine when it comes down to it, not just producing the result, but defining what they mean, kind of setting some clinical boundaries. And we do this every day on our reports, so it just needs to be elevated up even more. And then kind of embedding interpretations into our different care models.
Yeah, I think those interpretations have to be at a level that patients, like the layman can understand, though, right? Like if it's medical jargon, that doesn't help anybody. Um, and it's what's hard for me with this, like ethically, is we have these large esoteric laboratories that are allowing contracting with these companies, right? And from a business end, it makes sense. They're probably making millions upon millions off of this, right? And Um, even some local laboratories are doing this from, like, a business perspective of trying to offer something to their community and encourage more uptake. Because there's some literature that says if you have direct to consumer testing, people people are more apt to do that maybe than to go into the doctor's office and get their testing done. And states have their own legislation around direct to consumer testing. So it's just a very complex environment. And I feel like our stake in the game, like from a regulatory perspective, is very low.
Mhm. Yeah,
Concerns
agreed.
me.
So we just have to figure out an advocacy angle. Otherwise, it's just kind of the loudest voice wins. That's a lot of social media and things. It's just that the loudest person might be 5 people out of 100, but those 5 people, because they are the squeaky wheel, they're the loudest, that they're the ones that are being amplified. So it's not a lot of times the most accurate one.
So here's where it sounds like we land. High IgG titers, generally protective, not harmful, but on demand, on access testing does have a high risk of public misinterpretation. So can we do anything about that?
I mean, I think it has to start with your local laboratory, right? Like, again, that localized laboratory expertise is so important to help the patients in your community understand, and that goes back to lab cares, right? Community and, understanding, like, the advocacy lens and, like, where you're and access to testing and having a balanced approach to all of these things. Because there are
Mhm.
environments where I think direct to consumer testing makes sense. I think what we've seen now is this over commercialization of, like, a commodity, and the commodity being, like, laboratory testing, and people are doing it way too much, and it's really affecting, diagnostic stewardship, and it's also affecting how patients relate to their physicians or there's all these articles now where people are putting things in ChatGPT, and it's actually, creating fake diseases. Right? Because
Mhm.
and so, like, if that's happening, um, then what do we how do we help the community understand so that Facebook posts aren't getting on there saying, like, "Everyone needs to go get their COVID IgG level because you need to know your risk stratification." Like, that doesn't mean anything, but if you read that, you're gonna think it does, right? If you don't have
Mhm.
the medical backing.
Yeah, I mean, I'm a proponent. I can see both, and that's why I like where you previously put the "and" in your statement, that we need to follow where our consumers and where our patients are leading, and everything is at your fingertips. You can order all of your things, and we also can't ignore that there's, a heightened level of distrust in the healthcare system right now, and people want to be able to take their personalized situation in their own hands and be able to understand what's going on with them, and maybe even having the opportunity through, direct access to laboratories to bypass, a physician that you have to wait forever to see him, and then you gotta get your labs done, but, you gotta schedule another appointment to take time off work to get the results, and all of these things. People want things faster and quicker and more efficient in their lives, and so we can play a part in that, but again, we have to be responsible, and if that means setting up, some different levels or some different operations within your laboratory where people can do a call center for and answer phone calls, or if people have questions about their results, maybe partnering with professional organizations to open pathology clinics, et cetera, in case people want to talk about things, or focusing on sending people to reliable websites, not ChatGPT, but there are like My Path Report is it .org or .com? My Path Report. Um, but again, sending people to reliable websites where they can do scientifically backed and, um, other research that is legit, basically.
Oh, and I'm glad you mentioned all of those. That's kind of where my mind went to, that it's great to have testing more accessible, but it's just completing it's got to be complete. So it can't just be having literal access to the test, but actually, for me, it's access to interpretation, access to clinical context of it, having a professional like at a pathology clinic or a doctorate in clinical laboratory science like our Dr. Nelson here to help us interpret some of those, or even just being better about our educational comments that are going out there or guidelines that are paired with them, and not kind of staying away from social media when it comes to some of those things and some of the influencers that potentially are just making money off of, can I get you to sign up to get this test done, instead of looking at the entire picture of access as a whole.
100%. I love the topic, Steph. Thanks for guiding us through that and the discussion, and Aaron for your insights. That it's really yeah, it's an interesting conversation. I think we should have it more. I know we've had an episode a little bit about direct to consumer testing, I think, before, this definitely seems like something that's gonna stay. So yeah. Well, thank you for
All
tuning
right.
in to another episode. We love seeing you guys when you guys log in and when you comment and you interact with our socials. So like and subscribe, share with a friend, and we will see you next time.